What are the important areas during the practical exam concerning the skull? Here the frontal view. The important one is this infraorbital foramen. Is important because it transmits the infraorbital nerve and vessels. Also, this is the zygomatic bone. It gives the frontal process of zygomatic bone, which unite with the zygomatic process of the frontal bone at this frontozygomatic suture. So this frontozygomatic suture can also be presented in the practical exam. تلاقي فيه بلاستر وعليه خط. This is the frontozygomatic suture. This is the nasal bone. This is not important at all concerning our concern in the practical exam. But this fissure, this is the orbit. We have here two fissures. This is the superior orbital fissure. And this is the inferior orbital fissure. The inferior orbital fissure can be marked. And the superior orbital fissure can be marked also in the practical exam. This is important. Concerning the lateral view here, I can mark the zygomatic arch and identify the structure of the zygomatic arch. Or I can mark it and name one structure related to it. It is related to retrotemporal nerve, superficial temporal artery, temporal branch of the facial nerve, zygomatic branches of the facial. Muscle attached to it, the masseter muscle arises from it. Concerning the temporal fossa, this is the superior temporal line, and if I mark this area, so this is the temporal fossa, origin of temporalis muscle. Means the structure attached, temporalis muscle. I can mark this area, which is H-shaped area, and I identify the marked area. This is the pterion. This is the pterion, where inside it, the middle meningeal artery and the vein grooves the bone inside it. So this is the pterion, the temporal fossa for the origin of temporalis muscle, the zygomatic arch for origin of masseter muscle, and it is related to zygomatic branches of the facial and temporal branches of the facial, retrotemporal nerve, and superficial temporal artery. Here is the maxilla, and this is the tuberosity of the maxilla. And this tuberosity of the maxilla is the origin of the deep part of the medial tergoid muscle. Attached to the medial tergoid muscle. It is attached to the tuberosity and also attached to the inner surface of lateral tergoid plate. What is also marked, this lateral tergoid plate from the surface. This is the origin of the lower head of the lateral tergoid muscle. And this fissure also is important between lateral tergoid plate and the maxillary bone. Tergo-maxillary fissure is also can be marked in the practical exam. Here is a mandibular fossa, can be marked. It is related to the head of the mandible to form the temporomandibular joint. And this is the eminentia articularis, or articular eminence, which partly articulate with the head of the mandible to form part of the temporomandibular joint. This is the external acoustic meatus. And this is the mastoid process for the attachment of the sternomastoid muscle. And this is the styloid process. It's not important in the practical exam, but this foramen is very important, the stylomastoid foramen, and can be marked also in the practical exam, because this is the site of exit of the facial nerve to reach the parotid gland or the extracranial portion of the nerve. Stylomandibular foramen. Medial also to the mastoid process, there is a groove. This is for the attachment of the posterior belly of digastric muscle. If we look here posteriorly, this is the external occipital protuberance, and this is the superior nuchal line, superior nuchal line. If we look to the vault here, this is the frontal bone, and this is the coronal suture. And this area is called the Brigna. The Brigna. It is the site of union of the anterior fontanelle. This is the sagittal suture, as you know, and this is the lambda. Is the site of fusion of the posterior fontanelle. Lambda between the sagittal suture and the lambdoid suture. So these are by far the commonest area to be targeted in the practical exam. If we look to the inside of the skull, the most important is the foramina. This is the anterior cranial fossa. This is the cribriform plate of the ethmoid, where the olfactory nerve passes from the roof of the nose to the olfactory bulb. And this is the optic foramen, can be marked in the very commonly marked in the practical exam. This is for the optic nerve and the ophthalmic artery. And between the two optic foramina, this is optic chiasma here. So this is a groove for the optic chiasma. This is lesser wing of the sphenoid, anterior colnoid process, lesser wing of sphenoid. And this is the middle cranial fossa. Or this is the pituitary fossa and the body of the pituitary gland. Pituitary fossa for the pituitary gland. And below it is the body of the sphenoid bone. Here there is a fissure also here between the lesser wing and the greater wing. This is the superior orbital fissure. And you can find a rope coming from here, exits from there, and tied around it. So this is the superior orbital fissure. And this is the foramen rotundum for the maxillary nerve. Below it is the foramen ovale for mandibular nerve, for also lesser petrosal nerve, for emissary veins. And behind it here is the foramen spinosum, for the exit of the middle meningeal artery and the nervus spinosus. And this is the foramen lacerum. Nothing passes through it. And this groove on lateral side of the body of the sphenoid is for the internal carotid artery. If we look here to the posterior cranial fossa here, we'll find this is the petrous part of the temporal bone, petrous part of the temporal bone. And this is the internal acoustic meatus, or internal auditory meatus, for the entry of the 7th and the 8th cranial nerve. Is very important also, can be marked. And here also the jugular foramen. Jugular foramen for the passage of the inferior petrosal sinus from here, the sigmoid sinus to form the internal jugular vein, and the 3 cranial nerve number 9, 10, and 11. Jugular foramen. And also this is the hypoglossal foramen, or hypoglossal canal, for the exit of the hypoglossal nerve. And this is the foramen magnum, for the passage of the spinal cord, covered by the 3 meninges, covered by CSF, entry of the accessory spinal part of the accessory nerve, vertebral arteries also passes through it here, anterior and posterior spinal arteries. So all these are content of the foramen magnum. Concerning the groove for the sinuses, this groove is for transverse sinus, groove for the sigmoid sinus, groove here for the superior petrosal sinus, groove here for the inferior petrosal sinus, here groove for the sphenoparietal sinuses. So this is by far the commonest important things concerning the skull in our practical exam. As far as the mandible is an important bone, I can mark this coronoid process. This is the insertion of temporalis muscle. I can mark the head structure rated mandibular fossa or temporomandibular joint. I can mark this fovea for the insertion of lateral tergoid muscle. I can mark the lateral border of the neck of the mandible. Mark here. And remember, here there are two structures attached to it: the capsule of the temporomandibular joint and the lateral temporomandibular ligament. It attached to the lateral aspect of the neck. This is the ramus of the mandible. At the outer surface here, if I mark it here, so this is the insertion of the masseter muscle. And here is the mental foramen for the mental nerve. This is the commonest area on the external surface. If I look to the internal surface here, I will find the mylohyoid line for the mylohyoid muscle. Above it is the sublingual fossa for sublingual salivary gland, and submandibular fossa for the submandibular salivary gland. And this is the mandibular foramen, which lead to mandibular canal. And this is groove for nerve to mylohyoid. And this is the lingula for the attachment of the sphenomandibular ligament. Don't forget this area at the medial side of the angle of the mandible. It's very common in the practical exam because this is the insertion of the medial tergoid muscle. And don't forget also, this is the last molar tooth, and there is a groove near the last molar tooth here. If you find the last molar and a groove just medial to it, so this groove is related to the lingual nerve. This is by far the commonest area in the mandible to be presented in the practical exam at this period or at this study. We're not interested in other studies which for the tongue and something like that, but this is the commonest thing for our study. Shukran.